Hello, this is Danielle Gardner, and I'm here with Dr. Nathalie Martinek. How are you going, Nathalie?
I'm doing really well, Danny. How are you?
Excellent. Now, just as a bit of an introduction, you are a wellbeing consultant, a mentor to physicians and healthcare professionals. And the main reason why we're talking today is because you are co-founder of the SafeSpace Health mobile app. And the purpose of our call today is because SafeSpace Health are looking for some really special people in the world to be part of their team and to contribute to what your mission is in the world at the moment in the healthcare industry. So how about we start by talking about what is SafeSpace Health? What is the app, and why do health professionals need it?
It's I guess I'll start with talking about what's going on with health professionals that they would need it. The statistics are starting to reveal more and more the burnout rate, mental health, mental distress, emotional distress, existential distress, suicide rate of doctors and other health professionals. But now the conversation is more focused on helping our doctors and our med students and all those coming through the medical training and education process, because they're suffering, and if they're suffering, then we're suffering too. So this app was developed to support some unmet needs, mainly that they don't have a place to feel safe to disclose what's going on for them. And we created this anonymous safe space that's unfiltered, that looks a lot like Twitter, but it's completely anonymous, and nobody knows anyone's identity, even the moderators. And it's to enable, number one, conversations that wouldn't normally happen out in the world face to face because of the stigma, the sense that doctors are superhuman, they're not allowed to have troubles, they're not allowed to suffer. If they are suffering, that means then they might be the patient, not the health profession. All the different stories that emerge out of that. There's a lot of shame around that.
And if they went to get help, they're getting help from inside their industry, really. And so would that be that concern of being, I don't know, found out or whatever.
Yeah, that's right. And there's fear of being reported as seen as incompetent or incapable of doing their job, even though there's many health professionals with mental illness who are getting treatment and are phenomenal professionals. In fact, they might even be more empathic and attuned because they are able to be with the suffering of others and see themselves in others. So we wanted to create this environment that didn't have any silos, hierarchies. Just we're humans having human experiences and wanting to learn about what's going on, develop some self-awareness about what we need, what our unmet needs are, not ours, but the health professionals in there, and then take them through this helping process from distress to self-awareness to setting very specific goals to meet those needs, or at least one need, as well as clear action. So they walk out feeling empowered with some approach that can help them.
All right, so we have, let me give a hypothetical situation. A health professional clocks off from their work, and they're feeling a certain way from what has happened that day or whatever. They're able to grab their phone, essentially, have a conversation in a Twitter-like type of environment, to be able to sort of debrief, get some things off their chest, engage in conversations. And so this is where the role of the moderator comes in. So how about you explain a bit about that, like people, because essentially you're looking for people who can be trained up as moderators. So let's look at when the moderator is on duty, what does it look like for them? What's their role and responsibility?
Yeah, so basically their main role is to maintain the order and conduct within the community. So there's some agreements that are implied and agreed to when they join up, which is about the way we respect each other, that we honor where each other's at, we're accepting, not judgmental, and that we can have different opinions, different philosophies and beliefs. So if someone rocks up and, you know, offloads what's going on for them, then the other users are likely to come and support, because that's one of the understandings. We're here to support each other as users as well as moderators. And a lot of the time, there'll be a lot of well-intended advice giving, some leaping to conclusions based on some assumptions, some over-identification of that person's story, which we all do. And have you tried this? Did you do that? What about this? As well as, I'm so sorry that's going on. So while that's beautiful and supportive, it's not necessarily helpful in addressing that person's need in the moment. So if a moderator would come in and seek consent to facilitate a discussion that involves everyone there, but really addresses the question or the issue of that original poster, and take them through the helping process while using a group facilitation approach to involve the others with understanding what are the skills being used here to help identify the problem, to help explore a problem, to help reach a goal that's really specific, achievable, measurable, time-bound, and you know, SMART goals, as well as here's an implementation plan. How about work on that together? Here are some resources that we have that could be useful. Let's have a look at them. So they're really skilled up in what's called wellness facilitation, using communication skills and coaching skills that are healing, validating, as well as very process-driven to take people through different stages of a helping process towards an action. So there's a lot of skills.
The skilling up of these people, because, and we're going to talk about the kind of people that you're looking for in just a moment, but give us a bit of an overview on, the training and what's involved there, the commitment in terms of time, money, anything like that. Yeah.
So the skills that will be included in the training. So I'm not teaching anything. We're not taking a didactic approach. It's all inquiry based. Just as the same things that we'd be doing in moderating group discussions, that's the format that will be used for training. So it's adult learning principles. And I want to know what everyone already knows, what they're already coming with, and to help people go deeper in understanding around that, how to apply that in a helping situation. So they'll be learning the helping process. They'll be learning about unconscious bias, how to detect it, how to disrupt it, how to help people through behavioral change using coaching models and theories around change. Maslow's hierarchy, and understanding that just because you're feeling like you're contributing to benefit in other people, if you're not if you're not taking care of your basic physical needs, you're not going to survive very long. You're going to burn out. So some of the skills is about what are our basic needs and what are the resources and the tools that are available to support looking after them, that are evidence-based. So it's learning about the tools, learning the skills of communication, inquiry, appreciative inquiry, positive psychology, group facilitation, and then applying all these things into how do we moderate in an anonymous setting. And the other thing is around suicide prevention, because we're also aware that there can be people in crisis who will be coming into this forum and needing a type of support. And so our role is also to know how to leverage the referral pathways. What are the already existing services that we don't need to replicate? That's not our role. We're kind of like a funnel or triaging, helping people either develop actions or referring them out. And sometimes a moderator will have to have a one-on-one chat with an individual if they're in crisis, and we have a safety plan that we're encouraging all the users to develop a safety plan, as well as how to start the conversation about their mental health and their suicide risk with their loved ones, so that they can reach out or be contacted automatically through the app if required. So we're thinking of everything.
And so all of these skills they can actually use in whatever existing career or business they have as well, which is fantastic. So tell us about the training.
And the other skill. And another skills about dispute resolution, resolving conflict, because, there's lots of times that in an emotionally heightened space that there's going to be argument, debate. And so role of the moderator is to recognize, this is going down. I can go in and help facilitate resolution, help a group come to consensus, and even come to agreement, even if it is, let's agree to disagree, but we can do it in harmony.
Yeah.
So it really is modeling the way we want to be experiencing our healthcare professionals. You know, we're helping demonstrate other ways of communicating that create an effectiveness in care, as well as beneficial outcomes for everyone involved. Yeah. And exposing them to that, and then helping the people, the users in the group, to even try these things out, so they become equipped in these skills and they can take on some of that moderator role, that course correction within a community. That
right.
Yeah. Sorry, I interrupted.
That's good. So where were we? Just about the like the commitment, like what is the duration of the training and things like that?
Yes. So right now it's around 2 months, and it's 3 times a week, up to 90 hours per class. So classes are Monday, Wednesday, and Friday. There are 4 different time slots to take into account the global community of moderators. And the topic is the same on that day. You just pick the one class that works best for you on that day. But just turn up to that. And so the first month is focused on the coaching, communication skills and healing skills, and the second month is on the group facilitation and moderation. And so it's roughly around 5 hours of class time. Then there's also the post-class reading and homework. So we have a textbook for the one aspect of the training. There's also peer-to-peer coaching. So everyone's put into a triad, and they practice the skills with each other once a week. So they continually work on their own problems, their own real-life problems, and the things that they're trying to grow into and make difference in their lives with each other. So there's that group accountability to keep this going, because we don't embody without practicing. So we want to become those who walk their talk. If we want to bring love into a space, compassion, we need to be filled with it. We need to be abundant in it so that we can share it. So that is the time. And
financially, is there any payment they need to make to receive the training?
Yes, not to receive the training. So the training, the peer support, and the monthly supervision they have with me or any other supervisor that gets trained up is free for the duration that they're moderating. The users, the people who are using the forum, it's also free. The out-of-pocket expenses will be around covering their own public liability and indemnity, their professional indemnity. Paying for the textbook, which is a wellness coaching textbook, which is phenomenal. That we're using that is to help with the curriculum, and as well as the reading to consolidate the learning from each class. Also assist training. So it's a requirement that all moderators look after their educational needs around suicide intervention prevention. Some people might want to update it if they've done it, many years ago. Because again, we all have people in our lives who experience crisis. And so these are all things that are useful. And those are the expense. And you have to look after your own taxes, because everyone is contracted. So everyone will be a contractor.
So they need to have an ABN, stuff like that. Actually, you're actually getting people from all around the world, aren't you? So not just ABN, the equivalent in their country.
That's right. So they can be able to receive payment. And the payment is $50 US an hour, which in Australia is about 70. And depends where they are in the world.
Beautiful. All right, so let's talk about why someone might choose to be trained up and actually pursue this to be a moderator, because I know that there can be some really personal reasons why they might feel called to do this.
So a health professional would feel called to do this because they see the suffering in their own profession and they've experienced it themselves, and they see where the need is. They know there are solutions and they want to be part of that. People who are coming along have parents who are doctors or health professionals, and watch the effect of their work on their stress levels, on their well-being, as well as their relationship with them, their child. Some people have just a natural affinity to want to serve this professional community, like myself. I'm not trained as a doctor, anyone in the conventional health profession, but it's been a calling for me. So people have to feel called.
And then it could be other people not associated with the industry, but have those sort of counseling, healing, sort of whatever, who just want to give back, right?
Yeah.
And it's almost like
back.
Paid volunteer work in a way.
Yeah. That's how it's been seen. That's how it's been described to me. That's how I would love it to be seen versus what's the pay? What is, you know, it's, you feel called, you feel like, you know, it's speaking to your soul that you want to be part of this. And you're giving back while learning these incredible skills for free and being supported to continue to use it and grow, doing your own personal development in the supported community that is committed and accountable to each other's well-being and their own. So this is stuff we pay thousands and thousands for.
Yeah, great. So I think we've covered just about everything. The final question I have is, how does someone apply to be a moderator?
Yeah, so I've got a link on my website. So there's a whole page about moderators on my website. And
we'll provide this link with the video.
Yes.
Cool.
There's also SafeSpace.health, our website. And you go to the contact page and I'll get the email of your expression of interest. So those are the two ways, or you could private message me on Facebook if we're friends, or, you know, even if we're not. That's another avenue.
Yeah.
And but I encourage everyone to read the description first before they do that.
And the training kicks off, I think you said first week of December. Is that right?
Yes. So I've managed to get many more people since we last spoke.
Yeah.
I'm starting the next one in March.
Okay. Right. Excellent.
So I'll be rolling this training every few months because I'm constantly recruiting. I want to build a massive team around the world.
Yeah, great. Excellent. And actually, there's one thing that I know we didn't cover yet, just in terms of the moderator's role. It's a maximum of 2 hours, 2-hour shifts. Is that right?
That's right. Thank you. Yeah. So moderators, in addition to the training, they're being trained to moderate. So it's maximum, or not maximum, it's 8 hours a week of moderation. So your moderation time is paid. And if you want to work more, you get to work more, but not past 9 p.m. I don't want anyone doing overnight shifts because, again, we're walking our talk of self-care and good sleep. Wow. And that's why we have a global community, so that no one has to work at night. Yeah. And so you can work more if you need to, but no back-to-back shifts either.
Yeah. But that's right. No more. The shifts are no more than 2 hours. Is that right? But it's 8 hours a week, but 2 hours. So 4 shifts. Yeah. Okay. Yeah. Awesome. All right. Is there anything else that you needed to add before we close this chat up, Nat?
Only that thank you for your amazing support, for everything I've been doing and am doing. And, you know, this is a work in progress. That's why we're design thinkers and system thinkers. We adapt as we go. Yeah. And it's being okay with imperfection and not knowing. And so we're hoping to instill that in the broader community.
Excellent. Well, this is such a great initiative. And, you know, I just encourage everyone who's listening or watching this to have a good look at it. And if you know anyone who you think might be suitable for the right reasons, not like, oh, that person needs a job, then, you know, pass it on to them and, you know, see where it goes from there. So thanks, Nat. It's been so lovely talking to you again. And we'll provide any links below this video that you might need to explore this further. All right. So thanks, Nat. We'll sign off and talk soon.